Nipah virus is one of the most dangerous and alarming infectious diseases known to modern medicine, a virus so lethal and unpredictable that it has been placed by the World Health Organization on the list of priority pathogens with epidemic potential. Yet, despite its extreme severity, it remains largely unknown to the general public, which is precisely what makes it so frightening. Because Nipah virus does not announce itself loudly or dramatically at first, but instead enters silently, disguising itself as a common flu before rapidly turning into a life-threatening neurological and respiratory catastrophe. First identified during a mysterious outbreak in Malaysia between 1998 and 1999, where pig farmers began falling ill with fever and confusion before slipping into comas and dying. Scientists later traced the cause to a previously unknown virus that originated from fruit bats, also known as flying foxes, which are the natural reservoir of Nipah virus and carry it without becoming sick themselves, shedding the virus through their saliva, urine, and feces, contaminating fruits, surfaces, and especially raw date palm sap, a traditional drink in parts of South Asia that has been directly linked to repeated outbreaks in Bangladesh and India, making the virus a classic example of a zoonotic disease, one that jumps from animals to humans. Yet what elevates Nipah virus to a global threat is not only its animal-to-human transmission, but also its proven ability to spread from human to human through close contact and exposure to bodily fluids, particularly in healthcare and caregiving settings, which has led to deadly hospital-based outbreaks and places doctors, nurses, and family caregivers at extreme risk. Once Nipah virus enters the human body, it typically has an incubation period ranging from 5 to 14 days, although in some cases it may be longer, and the earliest symptoms are deceptively mild and nonspecific, including fever, headache, muscle pain, fatigue, sore throat, nausea, and vomiting, symptoms so common that most people dismiss them as seasonal flu, food poisoning, or simple viral illness, delaying medical attention during the most critical window of opportunity. But as the virus continues to replicate, it begins attacking vital organs, particularly the brain and lungs, leading to a sudden and devastating progression marked by dizziness, confusion, altered consciousness, disorientation, seizures, severe breathing difficulty, and acute respiratory distress, ultimately causing encephalitis, dangerous inflammation of the brain, which can rapidly push patients into coma within 24 to 48 hours. And it is at this stage that mortality skyrockets, with fatality rates reported between 40% and 75% depending on the outbreak, healthcare access, and speed of intervention, making Nipah virus one of the deadliest viruses known, surpassing many better-known diseases in lethality. Diagnosing Nipah virus is exceptionally challenging because its early symptoms mimic numerous other illnesses, and because confirmatory testing requires specialized laboratory facilities capable of performing RT-PCR and serological analysis on blood, throat swabs, urine, or cerebrospinal fluid resources that are not always immediately available in outbreak regions, further delaying diagnosis and isolation. And compounding the danger is the harsh reality that there is currently no specific antiviral treatment and no approved vaccine for Nipah virus, meaning that medical care is largely supportive and focused on managing symptoms, controlling seizures, maintaining oxygen levels, and providing intensive care support. While some experimental treatments such as ribavirin and monoclonal antibodies have been explored, their effectiveness remains limited and not conclusively proven, leaving prevention as the most powerful and reliable defense against the virus. Even among survivors, the battle often does not end with hospital discharge, as many are left with long-term neurological complications such as memory loss, personality changes, chronic fatigue, seizures, and in rare but deeply concerning cases, late onset or relapsing encephalitis that can occur months or even years after apparent recovery, underscoring the virus's capacity for lasting damage. Repeated outbreaks of Nipah virus are not random events but warning signals reflecting deeper environmental and societal issues, including deforestation, urban expansion into wildlife habitats, climate change altering bat behavior and migration patterns, increased livestock farming near bat populations, and unsafe food handling practices, all of which increase opportunities for viral spillover from animals to humans, demonstrating that Nipah virus is not merely a medical problem but a consequence of how humanity interacts with nature. And this is why public health experts emphasize prevention strategies such as avoiding consumption of raw, date palm sap, washing fruits thoroughly, discarding fruits partially eaten by bats, minimizing contact with sick animals, implementing strict infection control measures in healthcare settings, using personal protective equipment when caring for patients, and maintaining strong disease surveillance and early reporting systems. Because, while Nipah virus should not cause panic, ignorance is far more dangerous than awareness, and knowledge remains the single most effective tool we possess. Nipah virus serves as a powerful reminder that not all threats are visible, that some of the deadliest dangers arrive quietly, and that preparedness, early recognition, and responsible behavior can determine whether an outbreak becomes a contained event or a devastating public health crisis. And by understanding this virus, how it spreads, how it hides, how it harms, and how it can be prevented, we empower ourselves and our communities to respond intelligently rather than fearfully, transforming information into protection and awareness into survival, because in the face of a virus with no cure, knowledge itself becomes a form of medicine.